Hello and welcome to the Bpositive Bloodstream, a podcast providing insights, stories and experiences from and for all those affected by acute leukaemia and beyond. My name is Jonjo Rooney and I'm the founder of Bpositive and the host of the Bloodstream. I want these podcasts to provide help, inspiration and belief to all people. Bpositive is both my blood group and my adopted mantra that I held throughout my treatment. I hope you enjoy our interviews, and if you wish to get in touch with us, then please do so by emailing us at info@bpositive.org.uk, or you can find us on Twitter at b_positive_org. Hello and welcome to the next instalment, edition, podcast, whatever you want to call it, for the Bpositive Bloodstream. This is a take two. I'm absolutely going to be transparent because I ran out of battery, but I've got Katherine Cox with me up at the NE Haematology Nurses Group Conference in Newcastle. Katherine, for those of you who don't know, is the leukaemia and myeloid clinical nurse specialist across the Newcastle hospitals.
Yeah.
Got that right. And we obviously, we said before, we didn't set an agenda for what we talk about here, but what I thought was great would be to grab you for a few minutes just to chat about the importance of events like this. And I think what I touched on before, and I've said to a couple of people today, is that it feels really important to, the breakout sessions are massive for me, because you think there's one type of blood cancer, or you think blood cancer just comes as one, or your leukemia, you isolate to your own world. There's so many different strands of it, and when Dr. Owen talks about acute lymphoblastic leukemia, seeing that chart which had all the different strands, you think, God, there's so much detail here. To have a breakout session that is specific not only to blood cancer but to your type of blood cancer, I think is massive. And I'm thinking back 13 years ago when I was diagnosed, I'd have been chomping at the bit to get along to something like that, and I can only imagine a load of people benefit from it. So I just wanted to get your take on that and the feedback you have, and sort of the benefit you see from the patients.
Yeah, so it's great to hear you think that about the breakout sessions, because they have evolved. So I've been a leukaemia nurse specialist for about 12 years now, and I'm also a member of the NE Haematology Nurses Group, and we're a group of nurses that span the whole of the northeast of England, from far south as the Yorkshire border to far north as the Scottish borders. And about 10 years ago, our colleague came up with the idea of holding a patient event. So as a group of nurses, we felt we did diagnosis well, we did treatment well, but we felt we were lacking in the support we were giving people after treatment, because that's often when patients are trying to get back into what they want their normal life to be, and what they don't know what that's going to look like. And that's when they're often faced with a lot of new emotions that they weren't expecting to have. So our colleague suggested we put on a patient event to look at moving on from the cancer. So some might refer to it as a survivorship event. And our first event was about 10 years ago, and I think we had 80 patients at that event, and we only had one room, and we had speakers from psychologists to nutritionists and physios, and it was very much aimed at trying to help people put almost a recovery package together for themselves. But what came out of the evaluation of that conference was that patients actually wanted a disease-specific session where they could mix with other people with the same diagnosis. And
because the content wasn't relevant to them, they felt, or
I think they felt it was relevant, but I think a lot of patients, I don't know about yourself, felt that although they knew they had a diagnosis and they felt they knew a lot about it, they didn't really understand it. So I think a lot of people actually wanted to revisit their diagnosis in a safe environment with other people in the same situation. So that's where we developed this idea of disease-specific sessions and a breakout session. And then this is our 6th conference, and over those conferences they've evolved. So now within the breakout session we have a clinical speaker, we have a patient speaker, and then one of us as a nurse specialist will give a living well for patients and carers. But that's very much a relaxed session. We open it up for questions. The discussion, although we may have a presentation to guide us, the discussion's led by the room. So sometimes we go off on a tangent about holiday insurance.
Whatever the talking point is.
Yeah, absolutely. And I think it's important because obviously blood cancers are huge. There's many of them, but a lot of them are extremely rare. So we actually only cater for 7 specific blood cancers at this event, and there's many, many more. But you are obviously restricted on finding space and the cost of events. So I think we do quite well with limited resources.
I think absolutely. And I remember in with Dr. Erin's clinical chat about in the acute leukemia session that I looked at, that I dived into earlier, the one I spoke at 2 years ago. So I was keen to just hear about updates, advances, and actually get a sense check on the room with how people were feeling about things. And it was great seeing Emma's patient talk, and I know Emma from a couple of years ago, so seeing how far she's come. But something Dr. Erin said really hit home to me. And it was when we looked at different cancers, that how many people get them, 77,000, 80,000 people. And she asked about, was it acute leukemia or the acute lymphoblastic? I think it was.
So she started off by asking about acute leukemia.
Yeah.
And then she split that into AML and ALL, so acute myeloid leukemia and acute lymphoblastic leukemia.
I think it was like roughly 3,800 for acute leukemia,
yeah,
700 for acute lymphoblastic leukemia. See, I've remembered the numbers.
Yeah.
And then take off 700 for that other number, you get 3,001, about 3,000 of AML.
Yeah.
Compared to the other diseases. So again, for me, that just signifies the importance of having these breakout sessions, that one size doesn't fit all with this world of blood cancer. So being able to hone in on such a small catchment of the population who actually get it, and are dealing with and living with leukemia, I think is massive. Engaging the reaction in the room, so many nodding heads from both talks, the clinician and also Emma's talk as a patient who's been going through treatment. And I just think that's what's really special about the event, because I haven't been to an event where they break up so accurately like that. I've been to a lot of events, I've taught at events where, and they're all great, they all have their own merit, where they're a bit more generic and they have psychologists and things, talk about general things that everyone can take away from. But I think you're absolutely right, and it's really pleasing to hear how, from your starting point for the North East Haematology Conference, was to listen to what people affected by blood cancer wanted, and to react and to turn it into that. I mean, now we've got over 250 people here.
Yes, that's right.
That's massive, and clearly it's going well.
Yeah, it's our most ambitious event, our most expensive event, and we're pleased to say we've been able to offer it free to patients through donations that we've worked hard to raise over the last year. It's always challenging, and I think we always need patient feedback to tell us how we can improve it. We're not the experts, the patients are. And I think that's what's so special about each disease-specific session. There is a patient in each session who has been through that experience, and that's really what other patients want to hear about when they come towards the end of treatment.
Yeah, and you're listening to them, that's massive.
Yeah, and I can sit and preach them about, their long-term effects of chemotherapy and give them aids and tools to help them cope with that, but to actually hear somebody who's been through it and is actually, I think Emma's words were, I'm excited about my future.
Yeah,
and I think most patients coming out of treatment for acute leukemia, or most blood cancers, find it hard to understand and think they'll ever be excited about their future again. So
that's exactly the point, and that's I say a big part. The book end of my talk is, the starting point and end point of my talk is, what did I want when I was being treated? And it was to see people like Emma, and to stand up and to be able to feel that actually I will get through this, and you can look forward to a bright future. But you do that when you take inspiration and hope from other people who've done it. It's such a dark world of cancer where bad news travels a lot further and people are absorbed to that, and you do get your clinicians and where people are telling you this, that and the other, but until you see it for yourself, I always tell people and advise people not to worry about other people, don't let other people's journeys define you, just focus on yourself. Like statistics, they don't matter to you, because they're a collective. Your story is a statistic in the making, and people like Emma talk about how excited she is to look for the future, can only make people behind her in that journey just inspired, and you could sense it in the room.
Yeah, you could,
so
couldn't you? The change in the room was incredible.
Yeah, it was amazing. What so honing in a bit more on your day-to-day, so away from these events, because obviously so much planning, preparation, care and attention goes into putting on an event like this at an amazing venue like Newcastle Football Stadium. It's such good kudos as well, I think, for the event.
Yes, thank you.
And great support. I mean, I genuinely mean it when it's such a pleasure and honour to be here, and I bump into people and people remember me from previous things, and I chat to new people. It's such an uplifting day. On your day-to-day, what does that kind of look like for you in the world you're in, with because obviously you cover myeloid and leukemia? So
I cover acute leukemia and myeloma, and I have a fantastic colleague, Sarah, who I work with, and I couldn't do my job without her. Our workloads increased so much, which is great. It's testament to how good we're doing with treatments. I think day to day we turn up to work, and you never know what your day is going to bring. So the first sort of portion of the day, the first half hour or so, is checking emails, checking voicemails from patients, trying to catch up on where people are at. We know the patients we're due to review that day, and especially with acute leukemia patients, we see them on our day unit. But anything could have happened. So it depends. If they're post-treatment, we may see them 2 or 3 times a week. We'll organise, coordinate all their blood product support, their follow-up treatments.
A lot of planning and logistics.
And often, now I'm a prescriber as well, often it's a case where Sarah and I can manage those reviews, and often they don't need to see a clinician apart from their clinic appointments, or if they become unwell. But often the days are very unpredictable. We go in with a set purpose. Each day is very different. because you have different clinics on different days, different meetings on different days.
Yeah.
But it just takes maybe a new acute leukemia coming through the door, or you've got a myeloma patient who's been rushed in, and very quickly you just have to be ready to change your priorities of that day to fit the need of what the service is at that moment in time.
And what about the emotional needs of those people? Because that must be a complete dichotomy.
Yeah, it is.
I was quite openly emotional. I mean, I was very young compared to other people on the ward, but I was in floods of tears some days, and I was hysterics of laughter the other, having a joke with them. You almost take for granted that the clinical nurse specialists and all the staff there are just there to absorb that, but that must be quite an undertaking for you as well.
Yeah, I think we're very lucky at Newcastle. We have a very good team, so our ward nurses, our day unit nurses, and us as a nurse specialist team. We're lucky to share an office with other nurse specialists, even though they specialise in different areas, such as bone marrow transplantation.
Yeah.
But we act as a support mechanism for each other.
Brilliant.
So if you are needing a bit of support, or you just need a bit of a help with conversation, there's always somebody. And I have to say, our doctors are extremely supportive of us as well.
Brilliant.
If
you feel like one team, does it?
Absolutely, yeah.
That's massive. I think that is, and I think you realise that when you're a patient, you know when it's a family. I was dreading leaving Worcester to go to Birmingham because I'd been in there for my chemo,
right?
And they felt like a bit of a family. They knew me inside out. They knew my highs and lows. Very quickly. I mean, over a period of like 6 months or something. You know, I mean, I was in isolation for a lot of that, so you get to know. You have your favourites, you know, you have your not so favourites, but you're all one family, basically like a family. But I think what for me stands out is that no day can be is always the same for you. You're reacting to different things, but strength in numbers, being that one team, I suppose, gives the patient more hope that you're all in it together. And part of the thing I speak about in my talk is a squad. You're all in it with the same. I remember my dad telling me, listen, these doctors, you're their project, you're their work. This is their day-to-day work. They have to get it right. That's what they want to do. You know. So when you start understanding and thinking of it like a team collective, it's massive. And by the way, when I got into Birmingham, then they became a family. It was just the scariness of going somewhere new.
Yeah. I think what's really important, I might be a bit biased, but within haematology, if you go to any haematology units, you'll find that there'll be people who've been in those jobs for years.
Really?
So I've been in my post nearly 12 years, and every day is still different.
Wow.
So even after 12 years, I'm still learning new things. I still have new challenges every day.
Yeah.
And I think as a nurse,
Keeps
that's
you
what keeps you developing.
Yeah.
You know, in haematology, there's always new developments. There's always so much going on, and I think professionals, if you get caught by the bug of haematology, you want to keep striving for more. Yeah, absolutely. You want to keep striving for more.
But it's an ever-changing world. Developments is even from when I was treated. When I was diagnosed, they told me, well, honestly, 15 years ago, you wouldn't have stood a chance. So I was made to feel lucky. And now that's 13 years ago. So people today, like improvements in transplantation care and the anti-sickness, I thought was amazing.
Yes.
I mean, that's what they said, anti-sickness back then. So 13 years ago was good, and Danstrom was like my best friend.
Yes.
But before that, they said, no, there wasn't very good anti-sickness before. One thing I wonder, and I got this fed back to me from other people in clinical, in the same sort of world as you, clinical nurse specialism, they said, and actually I gave a talk at the, Flora, you remember Flora, who you spoke about, named Flora, she was a clinical nurse specialist, and she asked me to, she helps sort of lecture the people at Royal Marsden School now for clinical nurse specialists, and they get cancer voices and patient stories, so I give a few talks to them, and one thing that came out of it was, when we had questions at the end, was a lot of those people training, because they're training on the job, obviously, they were saying, we don't see patients afterwards. It's so refreshing to see someone out who's come out the other side, because they leave us and often they don't want to come back.
Right.
But it's so rewarding for them to see how well people are doing. I mean, do you get any of that? Or?
So I think as a clinical nurse specialist where I work, I'm very fortunate because I get to follow people up after their treatment and in clinic. And with acute leukemia, for example, you'd probably follow them up for at least 4 or 5 years. With myeloma, obviously, that's not curable at the moment, so patients are never discharged from our clinic. So we get really great relationships with our patients.
You must forge really strong bonds with them.
I think what's hard is we see our nurses, especially on the inpatient wards, who are caring for the patients in the midst of chemotherapy or bone marrow transplantation or CAR T cell therapy now as well. And they're very much there for the acute illness. They're there when patients are really, really sick, and they're there to do these hard treatments, but they don't get the benefit of seeing the patients, even though it's only a floor below them. They don't get the opportunity to come to clinic. And I think our patients are very kind, and often they will go and visit the wards, even sometimes for years to come,
Really?
especially at Christmas, and that's so important for the ward nurses because they don't get that side of the job that as a nurse specialist you do, and it's part of the rewarding side of our job.
So those people who do go back, they go in front of the patients going through it as well?
Often it's just a case of popping back to the nurses.
Yeah.
Like I say, Christmas is often a very emotive time for people, and they want to come and see their team and bring a box of chocolates.
I've done that as well myself.
Yeah, and I think
actually it does really lift their day.
It's amazing.
They remember every detail of your illness.
Yeah,
That's
and you
what
have to remember, as much as I'm a nurse specialist and I'll look after some people for many, many years, the nurses on the ward are the ones that are holding their hand when they're septic, or we might be having ITU discussions, or they're the ones actually at the nitty-gritty end in the middle of the night when you might be having to get a doctor in at home. So those nurses will always remember the patients, and the patients will remember them, but it's just not having the opportunity to see them when they're well.
Yeah. And I can understand it. From some patients think, I don't want to go back into this world. I don't want to, they might want to just think, I want to get better and just let go. Yeah. I always found that I took a great deal of sort of pride really in going back, because I felt proud that I was going through it, and I didn't ever want to make them think that I was sort of took that for granted and forgot. So even taking, I think it was Christmas, box of chocolates, went back into Worcester and Birmingham and just leave them there. And what did strike me actually, I think I didn't go there expecting some kind of fanfare, but they're working, and every day they are working. There's people in the exact same position I was, so I felt like I was almost potentially treading on toes. So I just left the chocolates, had a quick chat to people. But even in that little sort of 5-minute session where I was catching up with them at the nurses' stand, I think one of the doctors walked past and she knew everything about me, Dr. King, and she was like, hey, she couldn't stop because she was walking, but she was like, yeah, had a quick hello, remembered everything about it. She said she couldn't get into my bone, I remember, because she struggled. They'll
always remember the difficult bone.
They'll always remember the difficult bone marrows. God, I don't forget them either. But that must be so rewarding, I think, for everyone, because I feel great, I think the nurses feel good, and actually those nurses probably tell the patients that day, listen, we've just been seeing someone who's 13 years post. That would lift my day when I needed it.
When you were on the ward.
I hung my hat on the fact that if other people are getting through this, I'd love to hear about it. And I was blown away by the fact that people do get through this, because you take the bullets of a diagnosis, and then when the nurses are like, 10 years ago, he's fine now, this person talking about it, just gives you hope. Yeah,
and that's what we very much want our patient events to be about. These are the patients who are attending today, most of them have completed their treatment, so they're through the treatment. What we want them to hear about is people who have then moved on with their future, so it's about moving on with that next phase. As difficult as the treatment was, they found ways to get through that. We really want to give them that extra encouragement and extra motivation that there is an exciting part to the next phase of their life. And fair enough, their disease and their treatment, you're never going to erase that. It will have shaped them and it will have changed their life forever, but we hope that they can see it doesn't all have to be negative.
I think that's absolutely prevalent, and I think you're absolutely right that this conference taps into the aftercare. I felt like after treatment, that's when I needed help most, because I was looked after all the way. Then you kind of spat out onto a conveyor belt of, off you go, no, you're exactly where you wanted to be, you're better, thank God, and now you have to recover. It was in that period I probably struggled most psychologically. I was just, so fortunate to be better and getting better, but I didn't know what to do with myself. And I felt like I was way behind other people in my life, my friends and stuff. I was having to think of what to do again. I didn't fancy getting back to the same job. All these things were coming on top of me, and I just felt like I felt a bit lost, whereas I think you almost take for granted at the time that just how well cared for you are, then you suddenly get out into the world that you've been dying to get into. I shouldn't say dying, but you've been absolutely desperate to get yourself to that period, and then when you're there, you kind of didn't know what to do. So I think events like this are massive for that.
And a lot of people, don't you find, it's almost an anticlimax, because you start treatment and your sole focus is to get to the end of treatment. You don't actually think about what next. And as nurses, we always, especially with acute leukemia, I find it hard because you don't really want to focus on what's next, because you have to help them through this acute intensive treatment. So I think patients are often surprised when they get to the end and the fireworks don't go off and it's not this great celebration. All of a sudden it's like, oh crikey, what is next? What does the future hold for me? And it can be really scary.
Oh, it is, absolutely. And by showcasing it and by having the talks like Emma today, I mean, people in that room think, I want to be where she is, I want to feel like she is, because people are at different stages of their journey. Even if they're at the same point, they'll be, take some people a good few years to come through it emotionally. They might be dealing with other things. I didn't have a mortgage, didn't have children. Some people are dealing with that, other things they have to think about. I just think it's absolutely fantastic. I'm really chuffed to be here. What would be the So my last question would be, what do you think would be the most sort of the best bit of advice you pass on to people if they come to you, and well, I suppose you do work with them closely. It's probably an impossible question to answer, but what one key thing do you think people should take away from going through this, and maybe when they've come through the illness, what do you think works best for people in that situation?
So, well, Jonjo, I think that's a really difficult question.
Sorry. It's a tough one to throw at you.
What one thing would I say to people? I mean, I think as a nurse specialist, what I've definitely learned is that everybody experiences their illness as an individual, and I think every individual has different experiences and like, as you just mentioned, different things to cope with within their life. So I don't think I can answer that question. I don't think there is one thing, but
that's fair,
I think from today's like today, it would just be to take away hopefully some inspiration from the patients that they're hearing from. And I must admit, the chat that's gone on in all the rooms, just even around the tables, people who've never met before, I just think takes some hope from the fact that other people understand how you feel. We understand, but we've not been there. But today they're in a room full of people who've been exactly where they are.
They know what that was like.
Yeah, absolutely.
That is a perfect answer for that question.
Okay.
Right, brilliant. Thank you so much for your time. I know you're really busy.
Well, can I just thank you for changing all your plans, because you should have been in Argentina, so I'll be eternally grateful. Thank you.
No, it is an honour to be here, and it's honestly, I think what you said, people, even at lunch talking, people meeting each other, and in the room after Emma chatted, nodding heads, people confiding in each other, that's amazing. And you know, anytime I love coming up here, and it takes me back to that world that I'm not trying to forget, but I focus a lot on the charity and podcast where I sit this side. Actually, it brings it back all to me, and I'm remembering how I felt at that point as well. So it's a real pleasure. But thank you, and I look forward to more of these, and we'll keep spreading the good word.
Thank you very much, Jonjo.
Thank you.